Chapter 44, Drugs Used to Treat the Musculoskeletal System. This is on page 678 in your book. So the first step we know is always assessing the patient. So a patient with musculoskeletal complaints, you're going to start by assessing them. Obviously, you're going to want to introduce yourself and develop a rapport with the patient. And as you're doing this, you can kind of get some information from them, where they're there, what's the degree of their condition, what's their pain level on their scale of 0 to 10, if they can, or the long Baker faces if they're kiddos. Have they tried any analgesics? What's been effective? What's the extent of their injury or pain, and any other details of the injury and how this occurred. Then you're going to want to talk to them about their medication history. What do they take currently? Any allergies? Activity and exercise. What can they do? Are they able to perform their own ADLs? Do they need help with them? Do they use a cane or a walker at home? Is this interfering with their sleep? Are they able to get adequate rest? Elimination patterns, is this interfering with that? How is their appetite? Are they able to eat? And then you're going to perform your physical examination, review any diagnostic studies that have been performed, and you can follow that by non-pharmacological nursing interventions such as heating pads, massage therapy, different measures such as that. So when patients are receiving medications that are used for the neuromuscular disorders, it's good to keep in mind they can cause respiratory depression, and some of them can even cause respiratory paralysis. So it's important to assess and monitor your patient. So obviously you do your initial assessment and then continue to monitor them for adverse effects up to 48 hours if they've received a neuromuscular blocking agent. So are they able to manage their own secretions? Are they swallowing? Are they coughing and choking with this? Monitor their vital signs. What's their oxygen saturation level? What's their respiratory rates? Remember, if it's less than 12, we're really concerned. Hypoxia, if they have an O2 sat less than 90%, we're concerned. If they've developed any tachycardia, any low blood pressure, if you look at them and they look like they're blue, that's a big problem. So you want to just look for all signs of any respiratory adverse effects from these medications, and have the equipment necessary, such as suction, oxygen, and if they need it, mechanical ventilator and resuscitation equipment. Keep in mind, neuromuscular blockers paralyze the muscles. They do not relieve pain. So somebody who has received a neuromuscular blocker, they're paralyzed, but it's not an analgesic, so it does not relieve their pain. But they may not be able to tell you that it has that they're in pain because they are now paralyzed. So early signs of respiratory depression: restlessness, anxiety, lethargy, decreased alertness, headache. Those are the early signs. So if you start to see those, you want to think, okay, we might be headed down a bad road. More intermediate signs could be abdominal breathing, intercostal muscle use, nasal flaring, and then later signs will be your shallow, rapid respirations and cyanosis. So nursing implications for musculoskeletal disorders. You want to help the patient adapt to provide their own self-care, so provide extra tools they may need or resources, occupational therapy. You can administer prescribed medications to help relieve their pain and discomfort. Talk to them about heat and cold and what may help them to relieve their discomfort. Elevation, if there's an injury with edema, you want to keep that elevated, help get the fluid out of there. If they are immobilized, keep them in that position of immobilization. range of motion exercises, and then promote relaxation. Those are all non-pharmacological, well, except for the medication one, measures that you can take. So neuromuscular blockers, these are medications that are generally used during anesthesia, during surgery to help relax muscle groups. They're used during mechanical ventilation to improve oxygenation. The patient must be intubated and receiving mechanical ventilation. So if you give a neuromuscular blocker and it paralyzes the patient can't breathe. So you need to be prepared that they need to be intubated because they're not going to be able to breathe for themselves. So neuromuscular blockers paralyze the respiratory muscles and the patient will not be able to breathe on their own. They may produce an increase in their saliva, so make sure you have suction ready and monitor for any respiratory distress. Assist with breathing, coughing activities post extubation. Again, patients aren't going to be able to tell you if they're experiencing pain. Hopefully they're sedated if they're receiving these medications because, again, it just paralyzes them. You want to talk calmly to patients who are experiencing respiratory distress. So if you have a patient who comes in who is extremely anxious and can't breathe, you don't want to be anxious yourself because that only doubles the anxiety in the room. So try and remain calm, have a calming approach with the patient. That's going to help kind of bring them down so that they can breathe better. The student nurse is caring for a patient with a traumatic spinal cord injury who just received a neuromuscular blocking agent. Which statement made by the student requires correction by the supervising nurse? A. I'll be certain the respiratory emergency equipment is nearby in case of a severe adverse effect. B. The patient has received a neuromuscular blocking agent and that's all that will be needed. C. The patient will receive a lower dosage because of the spinal cord injury. Or D. I'll be sure to administer an analgesic and sedative after the neuromuscular blocking agent is given. So the question is asking which statement made by the student requires correction. So which one is not correct? The answer is B. Neuromuscular blocking agents interrupt transmission of impulses, but they have no effect on the patient's level of consciousness, their memory, or their pain. So again, they can be fully aware of what's going on and not be able to say anything to you. Patient education, you want to talk to them about pain relief, activity and exercise, psychosocial effects, sedative effects, drug therapy for muscle disorders, skeletal muscle relaxants. These are used to treat low back pain. They're used for spasticity, muscle spasms. Spasticity is characterized by stiff, awkward movements and is often a result of multiple sclerosis or cerebral palsy. So this is not necessarily just an acute injury. This can be a chronic condition. And they are generally treated with anti-spasticity agents such as baclofen, dantrolene are the two we're going to talk about. They can also be treated with diazepam. Muscle spasms, these are often associated with skeletal muscle trauma or inflammation. So this is going to be your more acute injuries such as sprains, strains, herniated discs, and those are treated more with your muscle relaxants, your Xanaflex, Soma, Flexeril. So centrally acting skeletal muscle relaxants, they act by depressing the central nervous system. They're used in combination with physical therapy, rest, and other analgesics. Common side adverse effect is sedation, and serious adverse effect is liver toxicity and blood dyscrasias. So what is blood dyscrasias? That's an imbalance in the blood. It can be in the any of the blood cells, so red blood cells, white blood cells, or your platelets. What is the function of centrally acting skeletal muscle relaxants? A. Act directly on skeletal muscle fibers. B. Produce muscle relaxation without sedation. C. Directly affect nerve conduction. Or D. Treat acute muscle injuries with associated muscle spasm. The answer is D. Centrally acting skeletal muscle relaxants are used to treat acute muscle injuries with associated muscle spasms. So muscle relaxants, baclofen is a common one that you will see. This is used to manage muscle spasticity resulting from multiple sclerosis, spinal cord injuries, cerebral palsy. So these are more of your chronic conditions. Adverse effects can be nausea, fatigue, headache, drowsiness, and dizziness. This can also be administered through an intrathecal pump, which is located in the spinal space, and it directly infuses the medication. It's generally used to manage cerebral palsy. It is important to educate your patients that this can affect their level of consciousness, and they should not operate or drive while taking this medication. Question number 3, which statement made by a patient with a long history of multiple sclerosis indicates a need for the nurse to further educate the patient? A. I'm feeling fatigued, but I'll stay on the medication and give it time to work. B. I stopped taking my baclofen 2 days ago. C. I'll continue my physical therapy along with the medications I'm taking. Or D. My muscle spasms are so much less severe since I've been taking the baclofen. The answer is B. Baclofen is a skeletal muscle relaxant that acts to reduce the reflex activity on the spinal cord, and it must not be discontinued abruptly. Direct acting skeletal muscle relaxants includes your dantrolene. This controls the spasticity of chronic disorders such as cerebral palsy, multiple sclerosis, spinal cord injuries. It acts directly on the skeletal muscle. It produces mild weakness of the skeletal muscles and decreases the force of contraction and the reflexes and spasticity. Serious adverse effects of that can be photosensitivity and liver toxicity. It can also cause weakness and drowsiness. It may decrease their level of alertness. Question number 4, which medication does the nurse expect to be ordered for a patient with cerebral palsy who is experiencing significant muscle contractions and stiff involuntary muscle movements and spasticity? A. Baclofen. B. Tracranium. C. Dantrolene or D. Succinylcholine. So which medication would the nurse expect to be ordered? Answer is C. Dantrolene, because it is a direct acting muscle relaxant that is going to act on the skeletal muscle to reduce the force of the reflex muscle contractions. The neuromuscular blocking agents interrupt the transmission of impulses from the motor nerves to the muscles at the skeletal neuromuscular junction. These paralyze the patient. They can be used to as a muscle relaxant or for general anesthesia. They can cause a histamine release, which may cause bronchospasm and an increase in their saliva and their secretions. So you want to make sure that their airway is patent. Again, make sure you have your suction nearby, any emergency equipment such as for intubation. Serious adverse effect is going to be your respiratory distress, diminished cough reflex, inability to swallow, and the treatment for overdose is going to be airway and oxygen management. These medications are on page 685 in table 44.2. And these are going to be medications such as your rocuronium, your succinylcholine, and these are not medications that you will be administering, so I don't expect you guys to memorize this table or really know these medications in depth. I just want you to know that these are utilized as neuromuscular blockers and that they can cause respiratory distress. So just be aware of them. Which is an important action of a neuromuscular blocking agent? A, producing muscle relaxation and reducing the use of anesthetic agents during the general surgery. B, improving muscular strength and decreasing risk of blood clots. C, inducing amnesia in the event of a patient undergoing a medical procedure. Or D, providing effective pain relief to a patient undergoing a short-term procedure. So what is the action of the neuromuscular blocking agent that we talked about? Answer is A. Neuromuscular blocking agents are used to produce enough muscle relaxation during anesthesia to reduce the adverse effects of general anesthetics. They help with intubation. They prevent spasms in the larynx. They do not provide analgesia, sedation, or have any effect on blood clotting. So just keep in mind the neuromuscular blockers are strictly used to kind of relax the muscles. They're used during anesthesia and do not provide any pain relief.